we are going to be demonstrating today a whitening technique, which everybody knows is bleaching. So we use Zoom whitening for our office here and for our other office, which is at Fort Dental Clinic. This is one of our patients, Savannah. She did her orthodontics with us, which Dr. Farsi did her Invisalign. There were a lot of space between the teeth and her bite was a little bit off. So her treatment was done here about a year or so. She had it done. This is what it looks like at the beginning. And at the end of the treatment, this is what it looks like at today. So also this is what it looks like. So Savannah is very happy with the way her teeth is. And also Savannah has an upper lingual wire to prevent the two centrals from going back into a space. So this is what the wire looks like. It was done well. The bite was checked. She was comfortable with it. Now today we're going to be doing Savannah's whitening to get her teeth nice and white, because she had the Invisalign done, and usually when we do Invisalign it stains the teeth a little bit yellow. So she had all the space closed, she had the bite correct. Now she had the wire done, but today she's going to be having her Zoom whitening done, and that is the video. We're going to be showing you the procedures and how we do our whitening here today. So this is our setup for the Zoom whitening. We always give our patients a glass to wear, which is the orange shield, to protect from the bright blue light that we use on the machine. This is for the lips so that it doesn't crack or dry. The suction tip cotton rolls are used to retract the cheeks and the lips. We also have a face shield that goes over the mask, over the cheek retractor, and we use a block out to block out the tissue that it's not burned. And this is our Zoom whitening. It's a full syringe and it is 22%. This is only used in the office. It is not a take home. Now this is the Zoom whitening machine. And it comes with different intensity of the blue light that comes from the head of the machine. So our machine works with a chip. So it has high, medium and low, depends. If patient has severe sensitivity, I put it to a low intensity so they don't have too much sensitivity. If patients are like within the medium, I could bring it a little bit higher. If they said they don't have any sensitivity during the procedure, I bring it a little bit higher, because the higher the intensity of the light, the brighter the teeth will get and the more white it will get. So usually for most patients who have no sensitivity, I use the very, very high one, which is very, very bright, and it's stronger than using the lower one. So with Savannah coming today, she has no recession, no cavity, which is a really, really good thing, because, and hopefully she won't have any sensitivity. Technically, before I do whitening for any patient at Broadway Dental, we usually ask them to use Sensodyne for 2 weeks prior to the treatment, so they don't feel any sensitivity. During the treatment, I always ask patient, are you okay? Any sensitivity, any problem, should I stop? Patient will tell us if they want us to stop or keep going. So this is Savannah, our patient. She had her hygiene done a few months ago. So I'm just checking, make sure there's no cavity or anything that we can see. Savannah hygiene is amazing. She brushes and flosses every day. So I just want to make sure there's nothing that would bother us from doing her hygiene. Also, I'm going to polish a little bit to take whatever plaque is off. so that the teeth can whiten much more and better. When you're ready. So I usually use pumice and mix it with water so it's very, very nice and runny. And then we polish the teeth to take all the plaque out. So this is the mouth prop we use when we do our whitening, Zoom whitening, so that we pull the cheeks and the lips and everything out of our way so nothing gets any bleaching on it or any chemical on the tissue, okay? We also, at this point, we're going to use something like a face shield and we put it over. So this is more protective. Okay? Good. So if you feel anything uncomfortable, let us know and we will stop. Good. Perfect. Now, usually I have the gauze. So every whitening kit comes with everything that we use, the gauze, the cotton rolls, and everything. I usually open it. I like to form a triangle and then I use this and I block the side of the cheek this way. It's protecting her cheek. I use a block out. And now what I'm going to do, I'm going to go around the gum line. I like to do this. Sometimes everyone does it differently, but for me, I do like to do this because I know for sure that the tissue are protected. So I just do a margin around. So I stop the cotton roll from moving towards the tooth surface, because I don't want anything to be there when I'm doing the whitening. And then I kind of light cure it. So I put the blue light, which gets the material really hard. Okay? And yeah. And turn a little towards me, Savannah. Amazing, thank you. So now, technically, when we bleach a patient's teeth or we whiten a patient's teeth, we don't want to go to the molars. We're not going to whiten the molar. We go from premolar to premolar. If a patient has a big smile, then we try to go a little bit towards the back so that they're, you know, they're not like half of my teeth is white and the other is not white. Savannah has a very decent smile, so I will try to go as much as I can and as far as I can to the back, but not the molars. Now what I do, I go into proximal and I blocked everything out that she doesn't come out with a white gum. Savannah is not going to be very happy if I do that to her. It may not look very neat, but at least it does a good job. It doesn't burn the tissue, and the way I'm doing it, I don't think it will. So Savannah is going for bleaching. Are you okay? Any sensitivity or anything? Usually when we do the blockout, if there's any on the tooth surface, I try to remove it because I want to bleach everywhere except the root. We do not go right to the gum line because it's too close to the gum, so I try not to do that. Especially if patient has any sort of a recession, it will be very sensitive. So that's why we give them a take-home bleaching to use with the same Zoom whitening. So the patient can actually monitor and do it for themselves, which is much more comfortable than I doing it, putting a very bright light to the tooth. Now we're gonna apply the whitening gel, and then we are going to put the machine on. So because since Savannah doesn't have any recession or anything like that, I'm gonna use the highest intensity so she has the better result. There we go. And we will start. We're going to use the highest with Savannah and see how it goes. Here we go. So when we're doing the whitening, we never leave our patients because we don't know if they're going to have a reaction or they're going to have any sensitivity or anything like that. So we always stay in the room with our patients until the procedure is done. Regardless if we do the whitening for an hour, half an hour, or whatever time is comfortable for the patients, we do that. We try to get the best result for our patients. Hopefully, Savannah one will be very nice today. So her first 15 minutes is done. We are going to see what it looks like. So what we do now, we remove all the whitening from her teeth. Okay, so for when we finish Savannah's whitening, Savannah already know that she cannot have any color food, no red wine, no coffee, tea, pasta, any pasta sauce, or sometimes even green vegetables. Some of them will stain. So she knows that only clear food she can have, banana or fruits, anything that cannot stain the tooth, milk or anything that's really naturally looking color, not colorful, is the best food for the next 72 hours. Because we're whitening the teeth, the pores are open. If any color stuff get into there, then the teeth is going to look more yellow than what it looks like before she had the whitening done.